Hello, I'm Dr. Catherine Toomer. I'm a family medicine and community health physician and founder of Total Weight Care Institute. And I wanted to come on today to introduce myself again because I founded Total Weight Care Institute recently, and I think it may have caused some confusion. So allow me to reintroduce myself. I won't go into my Jay-Z impersonation right at the moment, but so what Total Weight Care Institute is houses all my endeavors, and essentially, I have various courses, one for patients, and I have one section for clinicians, and then later I'll have a nonprofit for advocacy and education for my local community. But right now, I have created Total Wellness and Weight Loss, which is a program for individualized weight health services where people maximize their health and wellness through weight loss. And I go after it's very individualized, very targeted measures based on the reason people gain weight. Everyone has a reason. There's a biopsychosocial reason, and weight is simply a symptom of those reasons. And so, what I do is I find the reason and then I attack it. I go after it. Well, as a team, we do it together, me, my clients, and my patients. And then the other part is the profitable uh, weight health practices, which is for clinicians who see patients who want to provide a comprehensive and compassionate weight care service to their patients while also providing financial freedom for themselves and having some time autonomy. When you have a product or a program that is very successful and very profitable, then it frees up your time. You can either make more during the time that you're practicing, or you can make the same and have more time to do other things. But that's important for us to feel comfortable as clinicians to serve and earn. It doesn't have to be one or the other. And so, because you want your practitioners to be happy, your doctors, your nurse practitioners, your PAs, you want them to be happy. You want them to be relaxed. You don't want them to be rushed, And so I created the program that I use actually to help others. And so I help now clinicians do the same. And so, but that they all came from the same place, because I know there's a little bit of concern when physicians start talking about profit. However, there's nothing wrong with that. As long as our core values, the core of service, the core of wanting to take care of people remains the same, then it's okay to be compensated for that. And there's also some concern when we talk about weight loss that it somehow implies a lack of body positivity and a lack of concern for people. Well, one of the things that I talk about is weight health. And the reason I talk about weight health is because, one, not everybody needs to lose weight to be healthy. And some people need to lose the weight that whatever in life is weighing them down. That's still weight loss. It's just not weight loss in pounds on a scale. And so, there's lots of different ways that you can lose weight that have nothing to do with um, pounds. So that's what I do. I have both programs, and they both came from the same place. They came from a place of desperation, from a program that I created from my own health crisis 22 years ago. When I was 36 years old, I was, over 200 pounds at 5 feet tall. I was an insulin dependent diabetic, and I went into congestive heart failure with a 50% chance of living 5 years. I was terrified. I was desperate. And when I couldn't find help, I created my own help. I became the doctor I needed. With help from my husband, he and I created my program to help turn my health around. Um, that included my mental health. I had severe depression, postpartum, cardiac, chronic, all mixed into one. And so I started there. I treated my depression, and I was able then to do all the other things I needed to do. And that is why compassion is a huge part of my programs, because it really is important that nobody ever feels shamed. it's really important that no one feels overwhelmed or feels like they've been abandoned or feels like they're being dismissed. It's absolutely important because I know what that feels like, and I never ever want to be the cause of that for somebody else. And so that is why I always say comprehensive and compassionate. It's absolutely imperative. It is a must. And so that's what I do. I provide comprehensive and compassionate care and comprehensive and compassionate training. So that is me reintroducing myself. And now it is all housed in Total Weight Care Institute because having all the different names, I keep those names and they're wonderful and people know me by them, but it's the Weight Care Institute. And if you look at the description, there are links to both programs, one for weight health, if you're an individual who wants assistance in getting their weight health back, regaining a sense of energy, of empowerment, of feeling like you're more in control. You're controlling what your body does rather than your body controlling you. Use that link. If you are a practitioner who sees patients who's feeling a little dissatisfied or feeling like there might be something else or feeling like this wasn't what you signed up for, like medicine has changed, and I understand that. But if you want to work on your own terms, and if you want to have financial freedom and time autonomy like I do, then I'll teach you how. So there's the link for that as well. So again, I'm Dr. Catherine Toomer, family medicine, community health physician, and founder of Total Weight Care Institute, the home of patient programs and clinician programs, and just and me.